right. So hello, everyone, and welcome to the conference. My name is Andrea Crescent, and I am the Community Engagement Manager with Brown County Public Health, one of the proud sponsors of the conference today. And before we get started, and before I introduce my co-presenter, I just wanted to read some quick notes from the conference organizers for you all, because there are some really important grounding thoughts that we wanted to share with you all. So, as Renita shared in the opening session, Margaret Mead is often quoted as saying, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's really the only thing that ever has." We're here today because of a similar group of individuals. This conference was made possible in part by funding from Brown County Public Health, with support from Prevea Health and the Brown County Coordinated Response members from Family Services, Golden House, and Wise Women Gathering. Thank you to all of those agencies. October is Domestic Violence Awareness Month, and though people don't think it's happening here, last year in Brown County, Wisconsin, county law enforcement responded to almost 900 reported incidents of domestic violence. In the state of Wisconsin, 36.3% of women and 32.1% of men experience intimate partner physical violence, intimate partner rape, or intimate partner stalking during their life. This conference aims to educate and connect resources and networks to do something about these statistics, with a focus on policy as an intervention. One resource we would like to highlight is the Be Safe campaign that was launched this October. Be Safe seeks to enhance awareness of local domestic violence resources and is a joint effort of Golden House, law enforcement organizations, and the Community Coordinated Response in Brown County. Led by community leaders and organizations, the Be Safe campaign seeks to reach victims of domestic violence by offering a free local resource, an easy-to-remember phone number to call or click when they need help. We invite you to visit 920-212-SAFE.com for more information, or to share that number with a victim who may be needing support. It's amazing what happens when we come together to help address the social determinants of health. Thank you so much for attending this conference. Please make sure to answer a brief 3-question survey at the end of your session, which we'll remind you about as we wrap up. So thank you for giving me a moment to read that important message from the conference organizers. And I wanted to take just a moment to introduce, or actually I'll have her introduce herself, Lydia Van Thiel, my co-presenter today.
Good morning, everyone. Thank you so much for coming today and being with us. My name is Lydia Van Thiel. I am the implementation director for the Greater Green Bay Blueprint to Prevent and End Homelessness. So I will be talking with you a little bit about that initiative, as it partners a lot with this CHIP work. So looking forward to meeting all of you and interacting with you today.
Thanks, Lydia. So I mentioned that my name is Andrea and I am the Community Engagement Manager with Brown County Public Health. What I didn't say is that I also wear another hat, which is I facilitate our community health assessment and community health improvement plan work. And so I will be speaking on behalf of the larger steering committee and strategy leads who work collaboratively to advance this work. But I wanted to just share that I'm wearing both of those hats today as I speak with you. So let's get into a little bit of an overview. So our goals for today are to provide you with an overview of what exactly is a community health assessment, what exactly does the community health improvement plan include, and what does that process look like? How do we go about organizing this work? Lydia then will talk with you all about actually doing the work, the boots on the ground strategy work, and specifically around housing strategies in our community. And then we will wrap up the session with an overview of implicit bias in community work, how it impacts and potentially stands in the way of success in our work. And then we will have just a little bit of time for some group collaborative brainstorming workshopping around some other excellent strategies that we know are happening in our community already, and to give some space for you all to share with each other. So that is an overview of what we're hoping to accomplish today together. So I don't know if anyone I'm just curious, out of familiarity, who is actually aware that we have a community health assessment and improvement plan process in our community? Great. So it's probably 50-50 split, I would say. And a lot of people don't recognize that we have these guiding documents, which really sort of govern how we engage in health improvement in our communities. So I'm going to go over just a little bit of detail around what they actually are and how they can potentially be impactful in Brown County. So what is a CHAW? If you hear us using sort of that public health speak and that lingo, CHAW just stands for Community Health Assessment. And I don't know if everyone realizes, but it is actually a required process that all local health agencies or health departments need to complete. For local public health, it's an every 5-year process. But in Brown County, we actually have a very I think unique and positive way to approach this work. And we partner with a number of our health systems who also have to complete a community health needs assessment, which is driven by the Affordable Care Act and is a requirement for the nonprofit entities that are health systems. And they have a requirement to complete a community health needs assessment every 3 years. And so we're very grateful that our health systems in Brown County are willing to engage in this work collaboratively to conduct a shared assessment of the health of our community. The community health assessment and health needs assessments, I'll just refer to them as CHAW moving forward, just so that it's a little bit less of a mouthful if everyone's okay with that. But the CHAW is really an initial step to try to understand the health of our community and what are those needs in our community. And it really is a foundation for moving forward into the plan that's developed as a result of the CHAW, the Community Health Improvement Plan. And we'll be a little bit informal today. If anyone has questions as we're going through, I think I'm speaking for myself and I'm guessing for Lydia as well. If there are questions, please feel free to just raise your hand. For those of us who are joining us online, please feel free to put questions in the chat, and we do have someone monitoring to review those questions. So for the Community Health Improvement Plan, then, that is a guiding document which drives active engagement by multiple partners, community members, and really just is sort of a commitment on paper to work actively towards shared goals and strategies. So as I mentioned on the last slide, the priorities that are chosen in a community are really informed by the results of the community health assessment. And they are not just developed by throwing darts at a dartboard, right? It's a very intentional and detailed process that's guided by a number of components that we'll talk about in just a second. But I really think one of the critical pieces is that it is a commitment by those who are in leadership power positions within our community. When I say the public health system here, I don't just mean Brown County Public Health or the De Pere Health Department or the Oneida Nations Health Department. I actually mean in this particular instance, the small H public health system, which is all of us who have a focus on improving the health of our community. So that includes a number of nonprofit organizations, that includes the Wisconsin Department of Health Services and other entities in the health systems, obviously, who are doing this work of improving health in communities. So it is a commitment by those who are engaged in that small H public health system to improve the health of individuals in our community by advocating for and directing resources towards those chosen health priorities and the strategies which are linked with them, which we'll go over in just a minute. So as we were getting started with this community health assessment and improvement plan process, we set some goals collaboratively as a steering committee that we wanted to ensure were met throughout the process. It was really important to us to use a clearly outlined process that was grounded in data. Now, by data, we don't just mean the numbers, we mean also stories, qualitative community experiences, et cetera. But we wanted to make sure that information and data about the health of our community was driving this process. And we recognize that the identities that you hold and the groups that you belong to will impact your experiences with health in our community. So we very, very intentionally called out the fact that inequities exist in our community and that we're actively committed to understanding them and developing strategies to address those gaps in health. Next, we wanted to make sure that we were choosing health priorities and strategies that were actually impactful, that actually moved change forward in our community, and that they weren't just words on paper. A lot of times we'll see plans where you set them and forget them and they go up in a binder and you're like, oh yeah, that's right. It's been 2.5 years. We should probably start thinking about that plan again. That is not the case with this community health improvement plan. And you'll see in a minute, we've developed an interactive dashboard. We have active engagement in the different strategies, routine meetings, and strategies we're advancing. And so making sure then that there's impact around those strategies is a critical focus of our work. This next one's pretty public health speak. So, but what we wanted to do is really make sure that, and our keynote this morning addressed this a little bit, but moving upstream, so earlier and deeper into the root causes of why things are happening and focusing on those conditions around people, not just the decisions that they're making on a daily basis, which honestly, we know to be only really 1/3 of their health outcomes, according to research, looking at environmental factors, social connectedness factors, access to healthcare, high quality schools, et cetera. So focusing on those determinants of health. And then critical importance, making sure that we're listening to our community members, integrating their perspectives, and taking that information and weaving it into our CHA and CHIP processes. So who's doing this work? I alluded to the fact that we have a steering committee and strategy leads, but right now, Beyond Health is the name of the steering committee. It's that organization that is advancing this work. And so it's made up of all of the agencies who have stepped forward to either lead this work or support it through active boots on the ground engagement. So just to give you an example of the organizations who are involved at the steering committee level, we have the 3 public health departments in Brown County. So the city of De Pere has their own health department. Brown County, obviously, who I'm representing, and then the Oneida Nation also coordinates their initiatives with us. They do conduct their own community health assessment as a sovereign entity, but we do collaborate and communicate regularly. And so they do sit on that steering committee, as well as Brown County United Way and Wisconsin Department of Health Services, and all of the health systems, including New Community Clinic, our federally qualified health center in town. So it's a really nice, robust group of health-focused organizations in the community. And then we were able to build relationships with a number of either nonprofit organizations, coalitions, or entities doing the work, or we organized small committees or groups to do this strategy work, which you'll see in just a minute on an upcoming slide. So the vision for Beyond Health is that Brown County would reach our full potential, enabling all people to live their best lives. Emphasis on the all and not leaving folks behind. The mission then is to create cultural change by addressing the top health priorities chosen by our community. And just so you can see, there's a little bit of formality behind this process. We did have a charter, which established the Beyond Health Steering Committee. And then in July of this year, we revised that document and adapted it into a guiding document with our core principles and strategies called out so that we are aligned and moving forward in a coordinated way. So let's jump into the CHA, the Community Health Assessment. So I mentioned earlier that the CHA is not just quantitative data, the numbers, the bar graphs, the charts, et cetera. That is, however, a large part of it. So we will collect community health statistics. We'll look at some of those environmental factors, a lot of other sort of data points, but we don't stop there. That's only one piece of the puzzle. We also collect qualitative data in the form of community stories, narratives, perspectives, insights from our community members through a number of strategies that we'll talk about later on in the presentation. And then we make sure that we're always circling back to those organizations and partners in the community who we're doing this work alongside, to get their feedback to make sure that the health assessment is meeting their needs. And then individual community members are given a chance as well to weigh in on the chosen strategies and the work that is happening. So social determinants of health, who's familiar with this framework? Okay, great. I'm glad, I'm not glad, but it doesn't surprise me to see that that's a fairly new terminology for some of you. In public health, we a lot of times forget that not everyone speaks our language. So I'm going to break it down into really sort of simple, sort of buckets for you all, which I think will make sense when we pause to reflect on what this is. So all we're saying when we use this framework of the social determinants of health is that we as individuals do not make decisions about our health in isolation. There are so many influencing factors that are oftentimes beyond our control when we are looking at individual decision making. And so what we're doing is we're moving it out to the community level, we're moving it out to the policy level, so that blame for unhealthy health outcomes is not sitting on the shoulders of individuals, but it's looking at us as a community, how responsive we are, and paying attention to the environment in which we live, work, play, etc. So these are not isolated buckets from each other. It's just a categorical way of trying to frame it up so that it makes sense. And so we can kind of, share language. But these 5 categories are very much interconnected and related. And I'll just read through them very quickly. So education, both access and quality, is a critical determinant or driving force for health across just universally. Additionally, not everyone has the same level of access to healthcare, and not everyone has the same quality of healthcare. There is a very, very strong body of research that shows that the color of your skin, your sexual gender identity, your age, any number of factors and identities that you may have will determine the quality of care that you receive from providers. And so actively working to address and call out and make changes in these spaces is critically important. Additionally, where we live, how safe our communities are, whether we have access to sidewalks, safe bike routes, green spaces, these all matter when it comes to health and whether someone chooses whether or not they're going to engage in healthy behaviors. The social and community context is critically important. We've seen from the federal level a declaration of social isolation as a crisis in our country, folks, especially after COVID-19, but even before, have just not been connected in meaningful ways. And so social isolation is a driving factor around the health of our communities. And then economic stability, to me, this is one of the sort of like, if you cannot pay your bills and if you do not have stable housing and you do not have a way to get to wherever you need to go, how can you focus on the other higher level things that are needed? And so as a foundational piece of health, economic stability. And we know that there are significant intergenerational gaps as well, and sort of the ability to have sort of money set aside from previous generations, home ownership, land ownership, all of these pieces influence health in a very significant way. So I mentioned earlier that we have focused on health equity throughout. I just wanted to highlight that the community health assessment does call out a number of the strategies that have happened locally, both at the federal, state, local level in terms of declarations of racism. And then there's also a page that highlights the impacts of racism on health and health outcomes. So obviously I'm not asking you to read this right now, but I just wanted to reference that information is there if you want to review it after this session. So once we've assessed the health of our community, then moving into the action phase is an intentional and thorough process. And I want to just go over, currently we're in the middle of a community health improvement plan cycle that will be wrapping up at the end of 2024. So we're actively in the process of assessing the health of our community at this moment, and we'll be releasing information over the next year, re-engaging with a number of you in this room who represent organizations here in Brown County. But for right now, the 3 priorities that Brown County is working under are equitable access, which is really a focus on taking steps to sort of level that playing field, making sure that everyone has equitable access to health, social cohesion or social connectedness, helping folks connect not only with each other, but also with their community. And then unified planning and policy. And this is the one where we are looking at both plans and policies to ensure that they line up with health in mind. So what does that mean then in terms of the strategy work? Brown County United Way is taking the lead on the first strategy, which is to decrease the income and asset gap, grounded in a lot of the ALICE work that they're doing, asset limited, income constrained, while still employed. So a lot of, sort of common speak, working poor, but, really what we have is this idea of needing equitable access to childcare, needing equitable access to a living wage, and a lot of those strategies fall into that bucket. Brown County Public Health is taking the lead on the second strategy, improving environmental quality, physical environments, focusing primarily at this point in time on lead exposure for little ones, because we know that that is such a key potential poisoning determinant of health and has lifelong impacts. And so that is the primary focus for that strategy. And then the Beyond Health Subcommittee is working on equitable access to healthcare, focusing on diabetes rates and mental health rates and early screening and detection in our community, aligning our health systems in a coordinated systems kind of way. Second priority is social cohesion. We are looking at building community connections at the neighborhood level. In NeighborWorks Green Bay, I don't think we have NeighborWorks in the room right now, but NeighborWorks Green Bay is taking the lead on social connectedness within sort of these neighborhood, sort of micro social levels. University of Wisconsin-Madison Division of Extension Brown County, aka Brown County Extension, is working on equitable food systems. For our third strategy, improving walkability and recreational opportunities, Wendy from Wello is in the room, so hello. And Wello is focusing on ensuring that we have safe opportunities to engage in outdoor recreational physical activities. So some Frogger campaigns, some outdoor winter mission campaigns, and a lot of focus on pedestrian safety and engaging in safe ways in community. So when we look at priority 3, this is the one that I think for some people, because those first 2 seem a little bit more concrete, this is the one where it's like, okay, hold on, what do you mean by that? So we have a subcommittee of folks working on the first strategy, which is focused on, for those comprehensive community plans that exist within municipalities, local government, visioning coalitions, sort of folks who are thinking about the future of our community, not 1 or 2 years out, but 10, 20 years out. How do we make sure that those individuals have health in mind when they're making decisions for the future of our communities? Lydia will be talking about the housing strategies in just a moment, so I won't go into that. But the Greater Green Bay Blueprint to Prevent and End Homelessness is the lead for that work. And then we have a structural change work group, which is part of the Health Equity Coalition in Brown County, which is looking at policies that exist now and looking at policy change as a lever for community change. This is fairly technical, but for those of you who want to know kind of how we're measuring and doing this work, we really want to make sure that we're using a data-driven approach. And so we recognize that these are not simple things. If they were simple community conditions to shift, someone would have done it already, because I'm not the smartest person in the room, right? So it's about bringing folks together, having intentional conversations, measuring where we're going, and using shared language to express complex, difficult topics. And we don't use, as I mentioned, just the quantitative pieces. So we're not using just data points. You'll see in our dashboard that we have consistently highlighted the story behind the numbers, because numbers in isolation don't tell us everything that we need to know. And so we want to make sure that we are giving that community perspective, that partner perspective voice, and we're sharing it as a part of our dashboard in order to continually review and adapt and make sure that we're actually engaging in meaningful ways. So if you want to pull out your phones, by all means, that QR code will take you to the Community Health Assessment and Improvement Plan landing page, and you can engage with our community health dashboard. And what you'll see is it's interactive. You can click down into the measurement pieces. You can click on sort of the why are we even focusing on this as compared to something else. And it's a really just interactive tool for understanding how we're organizing this work. And then you can also see some of the success stories. We update it mid-year and year end at a minimum with updated information about how we're advancing this work. So with that in mind, I'm going to turn it over to Lydia, who's going to talk a little bit more about specifically doing this work at the strategy level and focus specifically on housing strategies in Brown County.
Just the next button. Yeah. Okay. All right. So advance the next slide here. So the Greater Green Bay Blueprint to Prevent and End Homelessness came about a few years ago. It was officially published in fall of 2021, but it was years in the making. So essentially what it is it's a comprehensive plan that provides a roadmap for the community to address homelessness and housing insecurity in this community in Brown County. So over the course of a year and a half, we developed the blueprint using qualitative and quantitative data. We looked at the Green Bay housing market study, local homelessness and census data, and also conducted some listening sessions with leaders, service providers, and people with lived experience of homelessness. So as we talk about implicit bias, it's really, really important that we're engaging the folks that have that lived experience of homelessness into the conversation so they can be part of the solution, part of telling their story. And it doesn't end with just creating the plan, that we continue to engage people with lived experience through the entire process so that we can ensure that we're checking our implicit bias and recognizing that though we might be in the work and be working with people experiencing homelessness day in and day out, that they know their stories and they know the struggles better than we do. So that was really, really an important piece of creating this blueprint. So essentially what the document does is it provides a long list of strategies and tasks that are meant to be collaborative. So as Andrea mentioned, we know that these are really difficult and complicated problems. And it's not going to be just one organization that is going to solve homelessness, right? It's about a larger community-wide approach, engaging the private sector, engaging the public sector, nonprofits, funders, the city, the county. Everybody needs to come to the table and address this issue. So it's meant to be very collaborative. It is very specific and action-oriented. It is focused on reducing harm in transforming systems. So there are about 98 tasks listed throughout this document of how we need to, as a community, address this larger issue. So again, it was published in fall of 2021, but we started the process of creating this document in early 2020. We hired Corporation for Supportive Housing was engaged into the community. They are a national organization that has developed these comprehensive plans nationwide. They're a national organization. And there was some collaborating partners that brought this to the table. So that included Brown County Homeless and Housing Coalition, Brown County United Way, Greater Green Bay Community Foundation, Brown County and City of Green Bay came together and really wanted to figure out how do we address this problem in Green Bay and specifically in our community. So this plan was created for Brown County by members and providers and leaders in the Brown County community. So some things that I just wanted to touch on, just considering the conference is an implicit bias conference, right? So how do we recognize the things that are happening within our own system? And one of the areas is the impact of racism that racism has on homelessness. So within the document, at the end, I will show you, I'll have a QR code. You can also find this online just by Googling Greater Green Bay Blueprint to Prevent and End Homelessness, if you really want to check it out. And there's a lot of really, really great data and information, but there is about 9 pages that really dives into the history over time in the United States that racism has had on impacting homelessness in our communities. And so obviously, not going to expect you to read all of this right now, just kind of wanted to share that it would start on page 19 with kind of how did we get here, and also share some data specifically about the Green Bay, the Brown County community. And if you look at some of that, you'll see that Black and Native Green Bay residents are experiencing homelessness at a rate that are 11 times and 4.7 times more than their representation in the general population. So we know that it's a disproportionate number of Black and Native Americans that are experiencing homelessness in our communities compared to their white counterparts. So that is something that's really important to consider and address in our communities, as well as for organizations to consider when they're working with people experiencing homelessness, and how do they build up their staff and their culture so that they're inclusive of Black and Native Americans, and ensuring that we're addressing the bias that we have when working with these individuals. So when we talk about preventing and ending homelessness, that's a really big topic, right? I mean, I think that there's a lot of people who are like, well, we're never going to end homelessness, which is not true. We definitely have the capability and the power and the passion in this community to address this head on. But when we're talking about what that means, it means that we're preventing homelessness when we can. And then when we can't, that homelessness is rare, brief, and non-recurring, that we're ending the cycle of homelessness, that we're shortening the time that people experience homelessness, because it is a super traumatic event, and that we are ensuring that it's rare when it does happen if we cannot prevent it. So that is really what we mean when we're talking about addressing homelessness, is as a system that we're ensuring that we're doing those things. So now I'm going to dive into each of the individual strategies, and you'll notice that homelessness is such a complicated and complex, multifaceted issue. And this is why it requires a larger community approach. And so you'll notice as I walk through some of the strategies in the blueprint that it really is a very comprehensive kind of trying to address all of the pieces of the root causes of homelessness. So the first one, and probably the most important, is access to affordable housing options. So we know that we have a real lack of housing in our community, but especially affordable housing. And so the goal here would be to develop new units, especially affordable housing, that we're engaging with landlords, providing incentives to landlords for renting to people with barriers on their record. Maybe it's a criminal background or evictions or low income, those sorts of things. How do we ensure that we're engaging landlords and providing them the supports and the incentives that they need to help people get off of the streets? And then increase our housing options utilizing the currently existing housing stock. So some examples that are being done in this community right now, nonprofits are looking at purchasing housing so that they can become landlords and can help prevent evictions and move people off of the streets quicker. So just an example of how we can utilize what already exists in our community to continue to get people off of the streets and keep people in housing. Strategy 2 is increasing access to and the coordination of services. So this is ensuring that providers, shelter providers and providers throughout the entire community, whether it's working on employment or financial literacy, all of those things, that there's some coordination between those services, that people experiencing homelessness have access to mental health and substance use services that are trauma-informed and culturally responsive, and also increasing the use and understanding of coordinated entry. Another one of those things that is very housing focused and sometimes jargon that if you're not part of homeless and housing world wouldn't understand, but coordinated entry is a system that the homeless services uses to be able to track and assess people experiencing homelessness or vulnerability and help them get connected to housing services. So ensuring that we're educating about that coordinated entry system and that additional providers are using that system. Strategy 3 is engaging employers and educators to be part of the solution. So that includes employers providing non-traditional employee benefits like childcare, transportation, and housing. You might be thinking, how is childcare and transportation relevant? But for somebody who's experiencing homelessness, if it's a family and they don't have access to childcare, they're not going to be able to get to work or get employment, save up money, and ultimately move out into housing. So these are just it's all interrelated. Andrea had mentioned that earlier, but this is these topics it's not just one thing to solve, but it's very interrelated and complicated, which makes it even harder for people to get maintain and obtain housing. Additionally, engaging Brown County school districts, social workers, McKinney-Vento coordinators into the homeless response system, connected with the shelters in our community, and increase employment pathways and training programs for people that are experiencing homelessness or at risk of homelessness, so that we can ensure that they have the income that they need to sustain themselves in housing and ultimately don't fall back into homelessness. Strategy 4 is this is my favorite one because it's a very it's a very deep, very complicated strategy, but it is preventing homelessness. So ensuring that that people have the income that they need, that we're helping them build wealth, and supporting employment, as well as decreasing justice involvement. So talking about preventing homelessness, building wealth, financial literacy, all of those pieces that help people remain in housing. Build safe and affordable childcare that's needed to increase employment opportunities. So talked a little bit about that in the previous slide as well, but also looking at exiting institutions and ensuring that people who are exiting the foster care system, that are exiting jails, inpatient behavioral health systems, that they're getting connected to housing prior to being released, so that they're not ending up on the streets, it's not exacerbating their traumas, and ultimately, and sometimes ending back up in jail or inpatient behavioral health systems because of the traumatic events of experiencing homelessness. And finally, strategic and cost-effective alternatives to ticketing and incarceration, ensuring that we're not criminalizing homelessness in this community, that homelessness is not a crime, and for people that are unsheltered, to ensure that we're not ticketing and incarcerating people for sleeping on the streets, or all of the things that kind of come along with experiencing homelessness on the streets. What it ends up doing really is they either go to jail or they have warrants out for their arrest because they can't afford the tickets, and it just creates this cycle of being incarcerated and coming back out to the streets and getting tickets that you can't afford. And it really just becomes this larger cycle. So how do we find some ways to address that in this community, ensure that we're partnering with the police departments and that they recognize and understand the impact that has on people. And then the last strategy within the blueprint is to tell the story. So informing our community about what homelessness is, what it looks like in this community. And that includes using the voices of people with lived experience to ensure that we're educating about what homelessness is and also what we're doing to address it. So this whole piece of the blueprint, that there are collaborative partners in this community working together day in and day out to really address this problem. And advocate for change in policies and programs. Within the blueprint is a section that's called the legislative agenda. Obviously, we know that that there are a lot of systems and policy barriers that end up causing or exacerbating homelessness. And so there is a section in the blueprint that dives into what policies specifically need to change locally, as well as at the state level, as well as at the federal level, to be able to ensure that we are able to get people off of the streets quickly, that we are connecting them to services. And a huge piece of it is preventing homelessness before it even occurs. So ensuring that we have enough resources in the community to help with preventing evictions and keeping people in housing so they never have to experience that in the first place. So I did put a QR code up here so you can access the full blueprint. It is a really, really interesting document. The first third of it is all that data piece, some of that really important information, the races, the impact of racism on homelessness. And then the last 2/3 are very specific action-oriented strategies on how we're addressing it. So we are actively working through the blueprints and ensuring that the community is putting the pieces together and putting this plan into place. And so this is a huge piece of really addressing that community health improvement and ensuring that people have access to really affordable and attainable housing in this community. So with that, I'm going to turn it back over to Andrea.
One of the things I don't know that we actively touched on as we were sort of laying a foundation for the community health improvement plan is how did we land on Lydia and the work of the blueprint and sort of integrating something that was already in existence that Beyond Health doesn't own, that Beyond Health doesn't tell them how to do their work. Like what was that process like? And so really what we did is we listened to our partners, we reviewed the data, we listened to what community members were telling us were the biggest concerns that they had, and we knew that housing was consistently a top concern in our community. We also knew though that we didn't want to be like right at the sort of, oh shoot, folks are experiencing homelessness right now in this moment point in time. We knew we wanted to move backwards, and we didn't have to look any farther than the blueprint. What could we have done that would have been more meaningful and impactful? That's something that the mayor of the city of Green Bay and the county executive, health system leaders, and everyone else were coming together and doing. So through relationship building and through connecting, through identifying shared purpose, shared goals, we were able to enter into an agreement that we would co-share information, that the blueprint, as one example, would be linked as a part of the community health improvement plan, but still maintain its autonomy. There were varying levels of discussions that happened for each of the different strategies that were chosen, but I just wanted to highlight that because I think sometimes people are like, okay, that's its thing, and this is its thing, and how do all the pieces kind of fit together? So I wanted to address that quickly before moving on. Please go ahead. Yeah, please. I'll repeat the question after you say it for those who are online.
Something walk out of the state prison. Yeah, and on top of that, follow-up question is if they drug felonies, I know it's not a law that they cannot prohibit a felony for running, yet they can do that concern. Do you have any advice for that?
So I'm going to try to summarize, but I may have missed parts of it. So correct me if I, and then Lydia's probably going to take this one. So the question is from an individual who works in probation parole and it struggles with housing placements as folks are going through the justice system. Yes. And any advice on if there are felonies on the record or other barriers that stand in the way, any suggestions for finding adequate housing? Is that kind of the spirit of the question, more or less? Okay, please. Do you wanna-
Yeah, absolutely. Yeah, that is a really complicated piece of the puzzle, right? Because it is very difficult for people with criminal backgrounds to find housing in the first place. And to do that before they're released. And that is one area that's addressed in the blueprint, is ensuring that that we are kind of trying to connect them to housing before they're released, but also exploring the barriers that prevent people that are incarcerated from being able to apply to places while they're incarcerated. So some of the program limitations of housing programs are that they have to be homeless before they can get access to some of these like rapid rehousing programs and that sort of thing. And so that's part of the legislative agenda as well, because obviously we need to do more to advocate for those kinds of changes in policies. And some of that's not just an easy thing. That's kind of a federal level or a state level that we need to come together and advocate around. But I would also just say utilize the resources that are at your disposal. Contact housing providers in the community and connect with the Brown County Homeless and Housing Coalition. They have different committees that meet to do case conferencing and have those kinds of conversations. But I think that's really the best bet of trying to do it. But it is complicated. It is, especially for people that have criminal backgrounds, it's very hard to find landlords that are willing to give people second chances and overlook some of those barriers. Another strategy that we're actively working on, along with building relationships with landlords, is trying to put together a landlord risk mitigation fund that would essentially be financial backing for landlords to accept tenants with barriers to housing, whether that's a criminal background or whether it's multiple evictions on their record. And it would offer that financial assistance if they were to damage the property or something were to happen, that landlords have a fallback option. So we're actively looking into that in the community too, which I think would help alleviate some of those issues. Yep. Yeah. Another question. Sure. Okay.
For Lydia.
Yes.
No, please.
So my question, I don't want to phrase it, I'm trying to stay present, but I used to work at a local hospital at night as a registrar in the ED. And we would have patients who would, during the wintertime, we allowed them to come hang out in the lobby while, you know, however many degrees. My question is that we had patients who, after getting discharged, they were stabilized, you know, they were medically okay, but they had barriers to home, like to home. I don't know what that was, but so like one patient, for example, she's like, call the police, then have them arrest me, so I at least have somewhere to sleep tonight. What can we do with like the medical field? I mean, I know technically it's not the scope, and I know for people who are admitted, they have case managers and everything, but in that emergency department setting, we have a lot of people who are homeless who come in for it because of homeless. How can we stop that cycle when we see it? You guys have like ambulance you guys can handle hospitals, like patients, like what are those resources?
Yeah, absolutely. That's a great question. So just for those who are online, the question was about for those who are working in hospital systems and emergency rooms, what resources are available to folks that are experiencing homelessness that come through the doors so that they can have quick access to housing. So we did create actually recently, so perfect timing, but the Brown County Homeless and Housing, the Brown County Homeless and Housing Coalition on their website has a few different areas where you can access resources. There's the Places to Go brochure, which is a list of a bunch of different resources. There's also housing assistance. I think it's called housing assistance of some sort. And that is a list of shelters and housing resources. And then we also have a flow chart that is, I think, up on our website now. We just officially approved that document within the last month. So that is a flow chart for how to, when someone's experiencing homelessness, what are the questions that you ask and how to ensure that you're getting them connected to the best resource. It's an after hours plan. So it has a list of the shelters that do 24/7 intakes and would be a great resource for people that are working in hospital systems and the emergency rooms and would love to get that more out there. So we're working on creating plans to ensure that gets out through the hospital systems.
Thank you for implementing that.
Yeah.
That's huge.
Yeah, absolutely.
I actually have one.
Okay.
So I used to work in hospitals, so a lot of these strategies that you're talking about are great, and I'm also wondering if you have any connections with like legislative state policy, because it feels like so many of these homeless programs and like housing programs in general, we made them so complicated because we keep slapping band-aids on the problem, and
Yeah.
now we're here with this ball of band-aids, where if we just would have stripped it down and rebuilt it, it would make way more sense.
Yeah.
So is there anything happening at like the legislative level, or do you guys connect with like, and we don't have a legislature that wants to talk to anybody either. So like, is there any of that work being done even to like start?
Okay, yeah. We do have the legislative agenda. We have an advocacy committee at the coalition that is putting together a plan for how to get through the legislative agenda and have some of those conversations. But yeah, they definitely don't make it easy, especially as they put together policies around it. So you're not wrong. And then
I have,
Andrea
yeah,
has-
just something to add. So not everyone is necessarily in the public health space specifically, but the Wisconsin Public Health Association and the Wisconsin Association of Local Health Departments and Boards, that is a mouthful, has a joint policy and advocacy committee, and we are actively monitoring housing at the state level in terms of the legislature. And anytime housing bills are coming forward, there are lobbyists who WPHA employs, not our local government, but that statewide organization has lobbyists who are actively monitoring and advocating for bills which come forward that are in line with best practice and with the goals of local coalition work that's happening as well. So, and if anyone has positions that they would like us to bring forward, I am the Northeast Wisconsin rep, so I would be the one who you would talk to if there were bills or pressing topics that maybe haven't been elevated yet, and I'm willing to bring that to the statewide committee. So any other housing questions quickly? Otherwise we can move. Yeah, please.
Really quick. Also a few years ago, the state of Wisconsin did create the Interagency Council on Homelessness, which includes directors from every statewide agency on it. And then also starting in 2024, the health department has requested a waiver for Medicaid, and Wisconsin agencies will be able to bill for homeless services now.
So for those of you online, Wisconsin DHS has requested waivers for Medicaid reimbursement. Yeah. So that will knock down some barriers. And then there's also a statewide you're going to have to repeat that one. Interagency council that is looking at statewide legislative and lobbying advocacy opportunities, right? Yep. Fair. Perfect. So in the spirit of time, let's make sure that we actually get to one of the key topics, which is implicit bias and its potential actual role in this work that we are doing. So we wanted to start off just ensuring that we're all on the same page and doing some foundation setting in terms of some shared definitions. So we have started off with including a definition of bias, which is really those attitudes, behaviors, and actions that are prejudiced in favor of one person instead of another, one group instead of another, primarily used in negative ways, right? There is a negative association a lot of times, but there are some default biases that we just hold that aren't necessarily as negative in their implications. But it's really, really critical to remember that bias occurs in personal interactions, it occurs in professional settings, and also in academic settings where we're setting a lot of the tone and the research and agendas for what we're choosing to study and understand. So some of these we are aware of, some we are not. For those that we are not as actively aware of, that's where implicit or unconscious bias comes into play. So combining words from the American Psychological Association and the National Institutes of Health to meet our needs, implicit bias is a form of bias that really occurs automatically and unintentionally, but it impacts our judgments, our decision-making, and how we act, the behaviors that we engage in. It targets specific social groups or identities, and it's oftentimes negative. So I think it's important to pause to reflect on the fact that this is not something we are actively choosing to do or consciously aware of, but rather a subconscious influence that seeps into how we see the world, what our perspectives are, which then in turn impacts how we make decisions and how we engage with others. And so when we are looking at the community health assessment and improvement plan, the philosophy that we have adopted is that we will intentionally acknowledge that bias exists, because that's a critical first step to being able to address some of the unintended consequences of bias in our work. And then really acknowledging that it does have potential to impact our work in terms of setting priorities and acting on them. The really key thing that you're going to see in just a minute is we can learn more about what those biases are and check our assumptions by connecting authentically with community through a variety of different strategies. And it really provides us with an opportunity to hear from the folks who might be disproportionately impacted by those biases when they're rearing their ugly heads. We always want to make sure that we're circling back and we're checking those assumptions about where we think bias is present. And if we're assuming it's not present, is that accurate? So making sure that we're minimizing and addressing bias whenever possible. So a little bit of the sort of tangible strategies that we have actively called out and integrated, and spoilers, think about these things as we're going through some of these categories, because we're going to give you an opportunity to engage in this space and reflect on what your organization might already be doing and where there might be opportunities for you to implement or engage in some of these strategies. So as we're going through some of these examples, maybe just pause to reflect on whether this is something you've engaged in or not, and that will help you out in just a few minutes. So we have, with the community health assessment process, engaged in focus group work. We were fortunate enough to be able to publish some of the results of some work that we did in partnership with the YWCA with funding from the Greater Green Bay Community Foundation, looking at the impact of racism on healthcare experiences and well-being for some of our communities of color in Brown County. Additionally, we oftentimes will have one-on-one interviews or discussion with community members who are either in leadership roles or representative of groups who we want to understand and know better. And so sort of, key stakeholder interviews is, a lot of times the lingo that we will use, but really just making sure that we're actually just talking to people. Turns out you can learn a lot when you just sit down and have coffee with people. So, that's a thing. So we also engaged during COVID in some small group conversations with housing providers. You can see some information about that in the community health assessment. There's a nice little summary of how we engaged in that space. And we've also been pulling together some community conversations. Brown County Public Health is leading this particular strategy, but others have led in other spaces, and some of the examples you'll see. But obviously fentanyl and opioids are an ongoing and hugely important crisis in our community. So speaking with individuals who either live with substance use disorders or who have been impacted by substance use disorders is critically important. So we've had a number of rural-based, Central Green Bay, Spanish language, other community conversations to really try and understand so that we are not making assumptions about what it is like to live with a substance use disorder if that's not our own personal experience. So then Lydia mentioned already the conversations with folks who do have lived experience, specifically with homelessness, but we also are engaging in conversations with folks with substance use disorder and a lot of types of lived experiences that help enhance our understanding of what it means to live in Brown County. So this is one of them that we're looking at rolling out over the next few months. We are working through the establishment, but there's a model called community advisory boards that a lot of you might have heard of. Madison, Milwaukee, a few other communities already have them. There are actually some groups that are up and running here in Brown County. We think that there's power in seeing community members as consultants in this work and supporting this work and helping us grow this work. So we will be rolling this out early in 24, promotion at the end of this year, and individuals will be paid for their time, $50 per session, and it'll be a 2-session commitment. So spoilers, if anyone knows anyone who wants to join in and share their perspectives, just watch for some marketing, some information coming out in the near future on that. Anyone done a photo voice project? Anyone have experience with that? So photo voice is really this idea of, we all have, most folks have cell phones now or some kind of access to tech to be able to get out into community and take pictures. We do also have devices as well that we can loan out if people do not have that access. And we want to see how people see our community. So this is a really nice way to have people capture pictures about what they love in terms of their health and well-being in our community and what might be standing in the way of them being fully healthy and sort of actualized, right? And so there will be an opportunity early in 24 again for folks to engage in that project and sharing a small brief narrative around why they chose that particular photo to represent how they engage in Brown County with their health. Right now, did anyone get a knock on their door yesterday? We were out for the first day, but we're doing door-to-door surveys on Saturday as well. So if you live in Brown County, you might be chosen. And we're just trying to understand experiences with health, emergency preparedness, and a number of sort of overall well-being questions. Actually, Wello has been a great partner in that space because they do an overarching measurement survey every 2 years. And we are adding some of the questions from that survey in order to enhance our understanding of whether the folks who maybe didn't have time to complete the survey couldn't engage by knocking on their door, can we maybe get some additional insights? So I just threw a whole lot of different strategies and things at you, but what we want to do is take the last 10 minutes or so to give you all a chance to apply some of these concepts to your spaces and your work. So what we would like you to do, you all have Post-its. If you do not, we have some right up here at the front table. But what we would like you to do is take a look around the room at some of the different white, oversized white pieces of paper. And we have just some general categories of ways that you might be able to engage in community, trying to understand if your work is laced with implicit bias or if you're actively addressing it, minimizing it. So we want to hear from you because I don't know about Lydia, but I always come to these conferences really trying to soak in ideas from those who are sitting in the room because, as I said before, I'm not the smartest person in the room. So when you are thinking about this activity, what I would like you to do, has anyone done mind mapping? It's sort of this idea of if there's a center category. So draw little lines and start connecting ideas. If you see something that's up on the board that feels really similar to what you were writing, put it right next to that one and make sure that you are taking a look at the different categories. Really quickly, I can't move around the room because I won't be mic'd then, but I think I can read them all. So on the right for you, my left, we're starting with listening sessions. So if you have engaged in listening sessions, maybe just include sort of what the focus was. Was it just general? You can write your agency name if you want, but you don't have to disclose that, and put a sticky note on there. The one back is formal research. So are you in an academic space or are you in a community-based organization that is engaging in formal research to help broaden our understanding? Up in the front, we have surveys. I would imagine at least some folks in the room have done surveys, but what was the focus? What were you hoping to learn? Focus groups, actually bringing folks together and having more in-depth conversations with a dedicated group of folks. The red one right there is interviews. Key stakeholder interviews, just conversations, discussions with folks. I got another one up there for you. So if there's something we're missing, throw it there. And then in the back, customer service, feedback or integration. So if you work with clients, are you integrating their perspectives and their voice into your programming in order to improve it? So please feel free, stretch, get up. Let's take the next. We have 8 minutes, but I know you all can do a really great, productive sort of brainstorming session. And we'll come back at 11:29 just to do a quick wrap up. Oh, yeah, thanks. For those of you who are online, I neglected to mention this. We do have someone who is monitoring the chat. So please feel free to throw any of your ideas in the chat. Thank you.
No, it's not.
I love it so much. Did you just update it while you were here?
Right here under example.
Wait for me, I think I'm sorry. Let's try to make time. Yeah, you just, yeah. My invader, or am I saying?
I recognize there are 2 questions on this screen. If you want to focus on the first one, by all means, but if someone did something that you absolutely love and you want, and you're like, I'm going to do this, please feel free to just write that down as well. But just in light of time, we'll probably just focus primarily on that first question.
You guys wanna like go for it?
Oh, sure, we can.
We want to, or?
You want those slides in there?
You could do whatever.
Sure. Is it gonna make us look super white?
Yeah,
Like
it's-
back. We'll just split. How about right here?
Yeah, that works. Oh, well.
You know.
Yeah, that's true. Less complicated. Bad place to sit.
Sure, we're.
Oh, let's see, what do you? Oh, trainings, yeah, maybe on the other one. Yeah, thank you. There's no wrong answer. Some of these might fit into, yeah. So it's like, it's that an implicit reaction. I did not even know I did it. So that's really. Yeah. You don't know it is. If I don't do that, then like. It's
So this be like a video because like I'll do like a clip stuff, you know what I mean? This one you're like.
I'm fairly certain that that's my mom.
That's my mom.
No, that's my mom. Yeah.
Just so you don't.
Yeah, I was like, and I know you've got art to add to that.
Oh, I think that they want to.
Yeah, that's right.
But I really like.
I love it. I love it.
If you like, if you routine, thank you for their.
Hey, that way.
It's really nice to meet you.
Question. I tried to when I found it. Naturally.
Thank you for all your good. Yeah, absolutely. And she is like, decided, but like wanted to
I'm
like
really good at
provider and then come back and she number. Like I like that one for
Read through that how much, you know.
yeah, it's on. I didn't actually write it down. Yeah. Thank you.
I'm sitting down.
I am not. I know, right? Like,
Oh,
that's- yeah.
Okay.
And then under. Okay, so that's where you'll find, I'd like to get back to the. Yeah. Okay, like that way you have.
Thank you. Like writing it. Thank you.
Yeah, yeah, absolutely. Yeah. It is hard to navigate.
Because they know getting that attention. Still, like, I'm reviewing, still, but we're like, oh,
That's okay, we can talk later.
Yes, where all the homeless people live. It really brought it to my attention of how big it is.
All right, y'all, I have a really quick summary slide. I love this engagement enthusiasm. Lunch is right after this. So if we're like a minute late, I don't think anyone will stop and not feed us. So please feel free. Lydia and I will stay after for just a minute, but summing it up, we want to make sure that we are intentionally calling out and addressing bias in our work, because that honestly is the way to move real community change forward. Connecting authentically with community, meeting them where they are and listening in an active way. Sorry, thank you. So connecting with folks where they are in an authentic way is critical, because it gives us so many opportunities to pause and reflect on those biases that might be undermining our work. And then giving us an opportunity to pivot as needed. And then there are so many different strategies, as you can see from around the room. This is only 5 minutes and we have a colorful rainbow of ideas that's coming up around us. Focus groups, advisory boards, listening sessions, just talking to people. And then the community health assessment and improvement plan process is committed to continuing to address biases in our work and move this work forward. It is 11:29 and I can get you out a minute early, but thank you all. Our contact information is there. If you want housing resources or have questions, feel free to reach out to Lydia. If you have general community health assessment questions or CHIP questions, we are both more than willing to answer any questions you might have, and enjoy the rest of the conference today. Thank you all.
Thank you.